Hello students, today we will discuss about the anatomy of maxillary artery. Now in today's lecture we will discuss only the first and second part of this artery, because you will realize that there are three parts of the maxillary artery, part 1, part 2 and part 3. So we will have a separate lecture on the third part of maxillary artery. So what is the first basic thing which you should know about this artery? That it is one of the terminal branch of external carotid artery. Now I told you in the class of the parotid gland that external carotid artery enters into the parotid gland, and at the level of neck of the mandible inside the parotid gland, this external carotid divides into the two terminal branch. One is going anteriorly towards the deep part of your face, and that is known as maxillary artery, and one will come out superficially on the temporal region, and that is known as superficial temporal artery. So this is the first and most important question for your exam, that maxillary artery arises at what level? Answer is at the neck of the mandible. So this is the neck of the mandible, and at this level you can see that the artery is arising from external carotid. So it enters the infratemporal fossa by passing forward deep to the neck of the mandible, 2 centimeter below the TM joint, and the important thing is the neck. So when you will see the arrangement of the arteries, you have to understand that external carotid artery, when it ascend, it will terminate at this point. After that, the external carotid is no more. Now you have the maxillary artery, which is one of its horizontal branch, and this is its vertical branch, and that is known as superficial temporal artery. And what level it is? It is around 2 centimeter below the TM joint, and this is area of neck of the mandible. It lies between the neck of mandible and sphenomandibular ligament. So first we will see what is sphenomandibular ligament. Now when you will see the sphenomandibular ligament, it is a fibrous tissue which extends from sphenoid bone to the mandible. That's why it is known as sphenomandibular ligament. And from where in the sphenoid bone? Answer is spine of the sphenoid. And as it will go towards the mandible, it become broad, and ultimately in the lower part it will get attached to the lingula of the mandible, which is a very important question for your exam. Where is the lingula and what is the attachment at the lingula? So lingula of mandible is a small bony projection just above the mandibular foramen. So when you will see this attachment of sphenomandibular ligament, you can see that this is the ligament, and this ligament is become broad as it will go downward, and it attached around this foramen, and this foramen is your mandibular foramen, and here you have a small bony projection is known as lingula. Now the most important question which you will have in the fill in the blanks nowadays, that it derived from, answer is that it is a derivative of first pharyngeal arch cartilage, and that is known as Meckel's cartilage. Now dear student, you have to keep in mind that there are two ligaments which you will read. One is known as stylomandibular ligament, and another we are reading here is sphenomandibular ligament. The difference is that stylomandibular ligament is a modification of the deep fascia of the neck, while the sphenomandibular ligament is a remnant of the perichondrium of the first pharyngeal arch cartilage, that is Meckel's cartilage. So you have to be very specific about these two things, that is what is stylomandibular and sphenomandibular ligament. Now when you will see the sphenomandibular ligament, between this ligament and the neck of the mandible, you have three structure. One is auriculotemporal nerve, second is maxillary artery, and third is maxillary vein. So when you will see this diagram, in this diagram, if I would like to locate the sphenomandibular ligament, so this is the lingula. Now from this lingula, and suppose in the base you have the spine of sphenoid, which is not visible right now. So if you will draw this ligament here, now this is the attachment of the ligament on both the side from the spine of sphenoid to the lingula. Now you can see that there is a gap. Now this gap is here. Now this gap is between the inner side of the mandible and the ligament. In this gap there are three structures which I am saying. One is auriculotemporal nerve, second is the maxillary artery, and third is the maxillary vein. So you have to understand that what is the area of your relation of the artery. Clear? Now in this diagram also, if you will see that this is actually the superimposed view, and you can see that this is the shadow of this sphenomandibular ligament. So there is a clear-cut gap present between the inner side of mandible and outer side of this sphenomandibular ligament, and this space contains your maxillary artery. Now here you can see that once you will cut the mandible, I told you that the ligament and mandible is having a gap. So once you will remove this mandible, you are able to see the structure which is outside this ligament, and this is your artery. Now why you are able to see the artery? Because the artery is running in the gap between the mandible and the ligament. So when you will remove this, when you will cut the mandible, ramus of the mandible, and as soon as you will remove the ramus of mandible, you are able to appreciate the maxillary artery, and this maxillary artery is a sandwich between the ligament and the bone. So this is very important part when you are doing the dissection in this area, that what are the structure you will find in this gap. So here if you will see this layer by dissection, you can see that if we will put the artery here, how it is placed here, it is placed in such a way that artery is now passing anteriorly deep to this part of the bone, but on the outer side of your sphenomandibular ligament. So what is the course of this artery? Now this artery usually runs deep or maybe superficial to the lower head of lateral pterygoid muscle. Now this is very important question for your exam, that what muscle divides the artery. For example, if you will have the axillary artery divided into the three part by the pectoralis minor muscle. In the same way, when you are reading the lateral maxillary artery, it is also divided into the three part by the relation of your lateral pterygoid muscle. And you have to understand that this is the lateral pterygoid lower head. The lower head is a larger head. If you remember the class of the lateral pterygoid, I told you, and this large head is actually the main structure which is dividing this artery into the three part. Now here you cannot see the artery in this portion because the artery is going deep from this border and coming out here along the upper border. So what you are able to understand, that this is the portion of the muscle which is superficial to the artery. So sometimes the artery may be deep or may be superficial to this lower larger part of lateral pterygoid muscle. Then the artery passes forward and upward between the two heads of the lateral pterygoid, and ultimately it will enter into the pterygopalatine fossa through a vertical slit is known as pterygomaxillary fissure. So when you will see this area, in this area you can appreciate that the artery is now coming out between these two heads. Now this is the upper head, which is a smaller head. This is the lower head, which is the bigger head, and in this gap you can see the artery is going, and ultimately it will enter into this portion, and that portion is known as pterygopalatine fossa. So you have to understand the course of the maxillary artery, that it starts from here, which is actually the label of the neck of the mandible. Then artery is going deep to the mandible in a gap between the mandible and sphenomandibular ligament. After that, this artery goes deep to this lower larger head of the lateral pterygoid muscle. Then it will emerges out between the gap of the upper and lower head of the lateral pterygoid. Then it take a medial turn because it will go deep into the towards the face and enters into the pterygopalatine fossa. Now what are the parts of the maxillary artery? So in this way, with the relation of this lateral pterygoid muscle, there are three parts of this artery. First part before the muscle, second part deep or superficial to the muscle, and third part is after the muscle. So the first part is known as mandibular part, which starts from the neck till the lower border of the muscle. Second part is known as pterygoid part, which is in relation to the lower part of the pterygoid head, lateral pterygoid muscle, and third part is known as pterygopalatine part, which is after the muscle and it enters into the pterygopalatine fossa. Now, the another important thing which you have to understand, that when you will see the branches of different parts of your maxillary artery, the first part and third part branches generally pass or exit through the foramens. So, this is the first basic thing which you have to understand, that when you will have the maxillary artery is having three parts, first, second and third. First part and the third part branches, they will supply the different part through the foramens or fissures which are present in the skull, while the branches of the second part are generally muscular and they will supply the muscles of mastication. Clear? So, now first in this today's section we will discuss only the first and second part. For the third part we have a separate video. So, what are the branches of the first part of maxillary artery? So, the first part of maxillary artery, it courses from the mandibular ramus to the lateral pterygoid muscle, which I just told you that before the lateral pterygoid muscle till its lower border you have the first part, and these are the 5 named branches: deep auricular and anterior tympanic, those are supplying the ear. Then you will have middle meningeal artery, which is entering into the cranial cavity, along with the accessory meningeal artery, which are the 2 arteries for the middle cranial fossa. Then you will have inferior alveolar artery, that is going, inferior means lower, alveolar means teeth line. So, it is going to supply the blood to your lower teeth, or you can say mandibular teeth, that is known as inferior alveolar artery. Now, the maxillary vein, when you will see the maxillary vein, it courses with the first part of maxillary artery and it joins with the superficial temporal vein to form the retromandibular vein. Now, what is the important thing which you have to understand, that whenever we are talking about the arteries, we always have the veins. So, here you have to understand that maxillary vein is actually present only along with the first part of maxillary artery. You will not find the maxillary vein along the third part, you will not find the maxillary vein along the second part. Maxillary vein form and it is present mainly along with the third part and then first part, and then it will form the retromandibular vein. So, the first branch, that is your 2 branches which are supplying the ear, and these are the deep auricular and anterior tympanic artery. Now, you have to first understand that this is your ear area. Now, suppose if I will draw, this is the ear area, this is your external acoustic meatus. So, what you are able to understand, that the ear lies behind the maxillary artery. So, this is the maxillary artery which is arising at this level from the external carotid. Now, from this portion, which is the first part actually, you have to understand that the branches will go posteriorly to supply the ear, because ear is behind the artery. So, this is the first concept which you have to keep in mind, that whenever the artery is supplying to the ear, it has to go posteriorly. Now, we will have the 2 named branches, deep auricular and anterior tympanic artery. Now, here you can see that these are the 2 branches, one is this and another is this. Now, these 2 branches are known as deep auricular and anterior tympanic artery. Now, these are the branches which runs superficial and deep in relation to the tympanic membrane when we are talking about the supply area. So, suppose if I will draw the external acoustic meatus and this is your tympanic membrane, this is your middle ear, then you will have the internal ear. Now, there are 2 arteries, we are saying that these are superficial and deep in relation to the tympanic membrane. So, this is the tympanic membrane. So, one artery will supply here, one artery will supply here. So, one is superficial to the tympanic membrane, one is deep to the tympanic membrane. So, which is deep? Answer is anterior tympanic artery. So, anterior tympanic, as the word tympanic means tympanic cavity, that is the part of your middle ear. So, anterior tympanic artery is supplying the area deep to the tympanic membrane, that means in the middle ear, while the deep auricular artery is supplying the area deep into the external acoustic meatus but outside the tympanic membrane. Why we are using the word deep? Because it is supplying the deep part of your external acoustic meatus but superficial to the tympanic membrane. So the deep auricular artery is more superficial and it supplies the external acoustic meatus adjacent area of this tympanic membrane. The deeper is the anterior tympanic artery, and this anterior tympanic artery enters into this middle ear with the passage known as petrotympanic fissure. Now this is the question of your exam, because when you will see the mandibular fossa, now this is the mandibular fossa. Now when you will see this mandibular fossa in a dry skull, you will realize that this fossa is divided into the articular and non-articular part by a fissure. And that fissure is known as petrotympanic fissure, and through this fissure this anterior tympanic artery will enter inside the middle ear. So this is the question of your exam, and through the same fissure, if you remember that you have the exit of chorda tympani now. So this is the important thing you have to keep in mind, that how this anterior tympanic artery enters into the middle ear cavity. Answer is with the help of petrotympanic fissure. Now in this diagram also you can see, now see, this is the chorda tympani which is coming out from this area and it is going to join your lingual now. So through the same area, if you will see, through the same area this artery is going to enter inside your middle ear cavity. Now you have the third branch, that is the middle meningeal artery. Now this middle meningeal artery is going to supply inside the cranial cavity. So cranial cavity is above, so it has to ascend. So after taking origin, it will ascend, and here you can see that this is the middle meningeal artery. Now this middle meningeal artery will ascend and it passes through this foramen spinosum. It passed through the foramen spinosum. So this is the question of your exam, that name the artery passes through the foramen spinosum. So this is the artery which is ascending and it is entering through the foramen spinosum and it will supply the inner aspect. But the important thing is that there is a loop of auriculotemporal now. There is a loop of auriculotemporal now. So it is embraced by the two roots of these auriculotemporal now. So what are the important question about the middle meningeal artery which you have to keep in mind? First, it is a branch of the first part of maxillary artery. Second, it is embraced by the roots of auriculotemporal now. Third, it enters through the foramen spinosum. And this part we have already included in the aortic ganglia, that there is a plexus around the middle meningeal artery, and that is a plexus of sympathetic branches which are postganglionic sympathetic fibers coming from the superior cervical ganglia, and one branch from this plexus passing through the aortic ganglia to supply the parotid gland. Now in this branch, in this diagram, you can see that this is the middle meningeal artery, then it will divide into the frontal branch and the posterior branch. This frontal branch is most common site of the rupture, and this is known as pterion. This point is known as pterion. So that we will already discussed. Now we will go to the next branch, and that is your inferior alveolar artery. Now as the name suggesting that it is going to supply your lower teeth. It is going to supply your lower teeth, and that's why it is known as inferior alveolar artery. Now when you will see the inferior alveolar artery, the important thing which you have to understand, that the spine of sphenoid and this lingula of the mandible is having a connection that is known as sphenomandibular ligament, and you have to understand that this foramen, that is known as mandibular foramen, lies just inside this ligament. So this artery is also become a contained between the gap of this mandible and sphenomandibular ligament, and this artery is going vertically downward. Then it enters into the mandibular foramen along with the inferior alveolar. Now then it runs into the mandibular canal and it comes out as a terminal branch that is known as mental artery. So it is descending artery. It descends to enter into the mandibular foramen, and from the mandibular foramen it runs into the mandibular canal. It passes forward in the canal and it supplies your lower teeth, that means molar, premolar, and its anterior terminal branch will supply the remaining teeth, incisor and canines. come out as a mental branch, and this mental branch supply the blood to the inner and outer side of the lip and the skin overlying the mental area. Then we have the next branch, and that is known as accessory meningeal artery. Now this accessory meningeal artery is actually sometimes the branch of middle meningeal artery, or sometimes it is a branch of your first part of maxillary artery. Now the question most commonly asked from this accessory meningeal, that it again ascend inside the cranial cavity, and there are two things which you have to understand, that it passes through the foramen oval. Whenever we have the foramen oval, we always have the word male. The structure through the foramen oval can be remembered by this mnemonic. Now M is mandibular nerve, A for accessory meningeal artery, L for lesser petrosal nerve, and E for imaginary vein. So this accessory meningeal artery ascend and enter into the cranial cavity through this foramen oval. Then inside the cranial cavity, it is a main blood supply to the trigeminal ganglia. So this is the question which you have to understand, that not only it is going to supply the dura mater of the middle cranial fossa, but also it is a main supply of trigeminal ganglia. So here you can see that this is your artery and this is your mandibular nerve. So it is ascending and entering inside the cranial cavity through this foramen oval. Now once you have the all dissection of first part, after cutting the or identifying the branches of the first part of the maxillary artery, you have to now trace the main maxillary artery, and you will find that it may be superficial or deep to the lower head of lateral pterygoid muscle, and that area is known as second part of maxillary artery. Now when you will clean the two head of lateral pterygoid, muscle and separate the two head, you will find one important artery coming out from the two heads and between the two heads, and that is known as buccal artery, and this buccal artery is coming out along with the buccal nerve, that we will discuss just in a while. To dissect the second and third part of the maxillary artery, you have to remove the lateral pterygoid. Why? Because the second part is deep to the lateral pterygoid, and you have to remove the lateral pterygoid if you want to see the branches of second part of maxillary artery. Now in this diagram, here you can see that this is the second part of maxillary artery, which is not visible in this area. Now once you will see the second part of the maxillary artery, you have to first understand the branches. So what are the branches? The second part of maxillary artery supplies mainly the muscles. In the initial part of this lecture, I told you that the branches of first part leave through the foramen, but branches of second part are generally muscular. So which are the muscles they are going to supply? They will supply the temporal muscle, they will supply masseter muscle. These branches will supply our medial pterygoid and lateral pterygoid. So they will supply pterygoid branches. Apart from these branches, you have a artery, and that is known as buccal artery. Now in this diagram, you can see that this is the buccal nerve. Now if you remember the class of my mandibular nerve, I told you that buccal nerve is a branch of the anterior division, and it will come out along the upper border. Now along with this buccal nerve, you can see that there is a buccal artery. So buccal artery is running along with the buccal nerve, and it is going to supply the buccal mucosa. So you have to understand that the major branches which are arising from the second part are muscular, and they are deep to the lateral pterygoid. So if you want to see the second part, you have to remove the lower larger head of lateral pterygoid muscle. So at the end of this session, you are able to understand that what is the origin point of maxillary artery, how you will divide the maxillary artery into the three part, what are the branches of the first part of the maxillary artery, what are the branches of second part of the maxillary artery. So this is all about today's class. Thank you.